March, as we welcome a good friend of ours, Dr. Eugene Cherny, to the desk, as we're going to talk about some things that obviously a lot of folks are talking about nowadays.
You saw it on the news everywhere. Of course, we're talking about Angelina Jolie. We talked about it a little bit here on our Great Day Morning Show program without going into too much discussion about it. But everyone's wanting to know, did she go too far, or is this the new pathway into preventing yourself from getting cancer? Of course, we're talking about Angelina Jolie.
Yes.
She removed her breasts at one time because she does run in her family. She lost her mom, her grandma, and I believe an aunt as well, and now she took the other extreme and got rid of some other womanly parts, you know, her ovaries and fallopian tubes. Obviously that's not your practice, but we kind of wanted to have that discussion with you this morning.
No, it's a great discussion to have. This is really where medicine is going. Eventually it's going to become inexpensive for everybody to have their whole genome printed out, and you'll know what cancers you're likely to have. Now she knows, because she can afford it, to have that breast cancer gene tested for, and she's got this incredibly strong family history.
Right.
So we call this a prophylactic mastectomy, when you remove the breast in a very high-risk patient. Usually it's done also when it's a breast that's hard to examine. You've biopsied it again and again. You're not sure. There's so much scar from all the biopsies you can't read the mammogram anymore. Those are really good candidates to do this for.
Now, you said she can afford it. Is this something that at this time costs a lot of money to do?
To get that BRCA gene tested for is a lot of money, and insurance doesn't always cover it.
Okay.
And you'd think it's a no-brainer to do it, but you know, we're fighting with insurance companies just to get yearly mammograms. I mean, we had to give up yearly mammograms to go every other year. Now some people are talking about, well, don't even do mammograms at all, just do self-exam, which is unfortunate.
Yeah.
Because so many people, you know, are caught early, and then so they have a much better prognosis the earlier cancer is caught.
You think it'd be cheaper to check a lot of people than to treat and give expensive treatment to people who get breast cancer? And
you know, you'd think so, but to the bean counters, not necessarily so. Not necessarily so. But what Angelina Jolie had done by taking out her hormone-producing organs, basically, is to take away any hormonal stimulation. There could have been just a little bit of breast cancer left after this, and so without any hormonal stimulation, it's very unlikely. I mean, that's like getting rid of that last 1% of risk that she might get breast cancer, is what.
So the cells may remain, but there's nothing there to stimulate them to grow into cancer.
She's done everything she possibly could to minimize this risk.
So a lot of people are kind of calling her cuckoo, but other people are saying no, she's doing everything that needs to be done to make sure she doesn't get this cancer.
That's right. She's got a lot of kids to take care of. She's going full court press. But what this really does, though, it's not comfortable to do either, because this induces like a very powerful sudden menopause. And the whole idea of depriving cancer of hormones means that you can't take hormone replacement. So she's going to have all of those unpleasant symptoms of you know, all the night sweats and all that kind of
forcing your body into a menopausal state.
I mean, wham, like right
you called
into
it menopause.
Yeah, I mean, bam. Yeah. I mean, a strong menopause, absolutely.
Wow. Okay.
So that's the downside of that. But the upside is, on the other hand, for those people that qualify for this operation, we have really great reconstructive implants now. And guess what? This is the one operation, breast reconstruction, that has to be covered by federal law.
Oh, it does?
Yeah, it was written about 20 years ago. It has to be covered by every insurance plan in the United States. So breast reconstruction actually is a right. You have a right to have your breast reconstructed.
So what's the difference between this one and this one over here?
Well, this is the round one, and this is the one that really is most popular for cosmetic surgery, because it gives you that look, that fullness up top, whereas this one is actually shaped like a breast, and I've used these on the breasts that I've reconstructed from scratch, and these look really natural. These look like the real deal.
So if you have to get everything removed in case of preventative measures, there are options out there, so people wouldn't even be able to tell. That
is close to becoming a reality, and the best reconstructions of all are when you have these prophylactic mastectomies and you have both of them off at the same time. It's terrible to have to undergo this, but it's wonderful to lose that breast cancer risk. You reconstruct them both at the same time. That's your best chance to get them even and to look really great and look really great. When you reconstruct one and try to match the other, you end up doing a lot of operations trying to chase the size and the shape to make it even, and it's much more difficult.
When you remove the breast tissue in a double mastectomy, for instance, do you go in underneath and you're trying to hide the scarring, or how does that work?
Ideally, there's better incisions being made now. Most of these operations are being done by oncoplastic general surgeons, and many of them will still use a traditional incision that's right across the top, because that gives you the best opportunity to see and get the breast tissue out. But you can use other incisions around the sides or just around the just around the areola, in fact, and those are very cosmetic.
Okay.
They have a big treatment algorithm as to who qualifies for these different things.
Now, looking at the way these things are designed, this one here seems to have a smooth surface on the top. This one seems a little rougher. Is that just
Yes.
Is that on purpose?
It is on purpose, and it actually makes sense. It's the reason that this is textured. They think that this inhibits hardening of the implant, but the main thing is that check it out. It's textured so it doesn't rotate. You don't want your breast to look like that.
Right. Sure. Right.
You want shifting.
Okay.
Right.
Exactly. A malrotated
So it stays in
breast.
place better.
Exactly right. You don't want to have malrotation.
Now, will tissue actually grow onto the device or not?
That's actually what this does. That texture, it's kind of like Velcro, and you'll have textured. That texturing has tissue actually grow into it, and it becomes more of a part of you. It stabilizes it. It's great.
Now, is this a surgery that's going to have to be repeated multiple times throughout their lifetime?
You can not necessarily need that, but it is known that breast reconstruction has a higher revision rate than cosmetic breast surgery because you got all this other stuff going on. Your patients are having chemo and they're malnourished from the chemo, or they're having radiation and the tissue is damaged. So patients will often need, more than one surgery to maintain their reconstruction. It's just because of all that other stuff that's happening.
Other things that are going on.
All right, but you have all the answers for people that have questions about
Absolutely,
this.
yes, we do.
I like the fact that you said that it's something that you can get done and the government will help pay the bill.
If you want reconstruction, you can have it, and actually fewer than half of the women that can have reconstruction do it. A lot of them, accept the new, it as a new normal, and I don't think you have to have a breast to be a woman, but some feel that to feel like a woman, they need to have their breasts reconstructed. So for those that do, this is available.
All right, tell everybody where you're located so they can come visit you.
I'd love that. That's I'm over at Heartland Plastic Surgery on Hickman Road. I'm in the phone book, and my website is www.heartlandps.com.
There you go.
We'll be happy to see you.
Wonderful. Thank you, sir. Good to see you.
Thank you.
Everybody, be good, buddy.
Thanks a lot.
It is 7:52. We'll be right back. You're watching Great Day live in Des Moines.